There was a great change in mental institutions and how mental disorders were viewed in society in the 1800s. Mental institutions became what they are today, from ostracizing the mentally incapable to working to rehabilitate them into society because of the major impacts of the 1800s. This was first considered a social movement, from containing the mentally ill to treating them. Mental illness was first shunned from everyday society and talked about behind closed doors. It was ridiculed and looked down upon in society during the 1800s. During this time period, many believed that the cause for mental illness was due to the supernatural influence on people's lives, such as possession of the devil and others. The mentally ill were chained in basement cells, and the viewing of these patients were only for entertainment purposes. Here, some patients are being ridiculed and laughed at by the very wealthy who had paid to see them. Often, the mentally ill were kept in inhumane conditions and treated with no respect, as if they were animals. Here, this is an example of a restraint cage where patients were put when they got out of hand, which today would be considered immoral and inhumane. Then, things started to change for the better during the 1800s, resulting in a different perspective of the psychiatric issues at hand due to the impacts of Dorothy Dix and Franklin Rush. Dr. Franklin Rush played a very important role in the changes in mental institutions and the changes in mental institution treatment of their patients. First, he started off as a doctor in the Army, but then used his medical skill in helping patients outside of the Army. Rush's greatest contribution to medicine was his contribution to the separation of religion and medicine, which banished the ideas of the supernatural playing a role in mental illnesses. He accomplished this by believing that all diseases could be tied to one problem: vascular tension. The differing levels of tension in the small capillaries of the body resulted in symptoms of manifested by the patient, which can include different mental illnesses and mental disease. Obviously, Rush's theory that all problems stem from vascular disease is not accurate, but it helped shape hospitals of mental illnesses everywhere, having them focus on relieving vascular tension instead of curing them of supposed supernatural maladies. In order to solve the problem of vascular tension, Rush created different techniques of treatment, such as bloodletting, which let all the tensioned blood out of the system. Also, Rush created a spinning therapy, which spun people around, making them disoriented and therefore altering the capillaries in their body, therefore reducing the vascular tension in their bodies. Dorothea Dix played a very important role in the social reform of mental institutions and the changes in their treatment towards mental patients. But first, Dorothea Dix started off as a school teacher. She then, in 1841, decided to volunteer at Sunday school to the female convicts at the East Cambridge jail. There, she noticed the people with mental illnesses being treated badly and inhumanely and wanted to change and improve their conditions. Dorothea Dix compared herself to the mental patients in these hospitals because she suffered from depression throughout her life. She spoke at many conventions throughout her life in order to gain support for her cause. She is a major abolitionist in this movement. She advocated for moral treatment, which was a new approach to mental disorders based on humane psychosocial care, such as talking with patients instead of punishing them, which was done before and did not seem to work as well as moral treatment did. Now, we compare the mental institutions from the 1800s to the mental institutions currently, such as this one. Back in the 1800s, as you've just heard, the institutions were not actual institutions. They were based on more inhumane treatments. But now, because of the impacts from the 1800s that were created by Dorothy Dix and Franklin Rush, the mental institutions currently are much more likely to succeed in treatments. One major difference from the 1800s to current day mental hospitals is the treatments that are used. Currently, more medications are prescribed to mental health, such as antipsychotics, antidepressants, SSRIs, etc. These medications also help calm down patients, so no necessary means of punishment needs to be used like it was used back in the 1800s. In addition to medication, psychosurgery is performed in order to help patients become normal for society, such as this lobotomy, which is pictured here. Also, there are different forms of electrotherapy that can help a patient recover, such as one that is being performed here. But not only does the amount of medication increase, but the amount of mental patients being let out of hospitals and put into outpatient care has increased. Back before Dix and Rush, mental illnesses were often kept hidden and patients were rarely let out of hospitals. But now, most programs for mental therapy focus on trying to get the patients back into the norms of society. This form of therapy displayed here is called group therapy, allowing patients to interact with other patients and be healed together. Now, mental illnesses are treated just like any other illness, which is by doctors in hospital settings with the appropriate amount of care necessary for each patient. Mental hospitals are what they are today because of the advances in social reforms that occurred in the 1800s due to the abolitionists such as Dorothy Dix and Franklin Rush.